My name is Marcus Daugherty, and I'm the Associate Vice President for System Innovation and Quality here at Partnership to End Addiction, a resource for prevention and recovery. Today, I want to answer some of your most frequently asked questions about finding and paying for treatment. This is Experts Answer. So a commonly asked question is, how do I pay for treatment? Technically, insurance or most insurance will cover for substance use disorder treatment. The thing that you need to pay attention to is the specific type of insurance that you may have in terms of what it will cover. And what I mean by that is there are some insurances that cover different levels of treatment. So you want to be specific in terms of what your insurance will cover. For example, if you need inpatient treatment or outpatient treatment or aftercare treatment, so you want to be specific in terms of what your insurance will cover in terms of substance use disorder treatment. If you don't have insurance, you can go to the SAMHSA, which is the Substance Abuse and Mental Health Services Administration's website. Go to the treatment locator, and there's also links there that can take you to insurance information and also insurance information by state. So that's a great resource in terms of attempting to find insurance in the event that you're not covered. Another question that typically comes up is, how do I find quality treatment for my loved one? One of the best ways to do that is also to go to the SAMHSA or the Substance Abuse and Mental Health Services Administration's website, and they actually have a treatment locator where you can find treatment facilities and treatment services by state and by location. Another great way to find quality treatment is to really ask a few questions of providers when you're looking for treatment. Ask about the particular type of treatment that they provide. Ask about what type of evidence-based practice do they use. And what I mean by that is, do they have counselors that are certified or credentialed that provide counseling, both individual and group? And do they have other types of providers? Do they have vocational specialists, for example? Do they have medical staff, for example? Do they also have discharge planning staff, for example, that might be helpful in helping your loved one transition back into the community once their treatment is completed? The other question that also comes up, which is somewhat related, speaks to what are some of the red flags that you might see. So some red flags that you should be aware of is if any provider says they'll provide free service, okay? Because we know that treatment services are not free and that insurance in some way pays for treatment. Be aware if a program focuses in on their treatment amenities. So for example, we'll fly you down to our treatment facility for free. We have a sauna, we have all these great amenities. The environment, the location is great. So all those things may be good, but the question really is, what are they doing specific to treatment? So programs that focus in on amenities as opposed to treatment could be an indication of a red flag that you need to be aware of. Okay. Another red flag would be if a treatment program says, oh, we'll help you get insurance if you don't have it. So they may help you to get insurance, but be aware that until you get insurance, you may be liable for whatever costs that are associated with the treatment for that particular facility or program. And the longer it takes to get treatment, if they do get treatment for you, you may be liable for that cost. So that's another red flag just to be careful of as well. Okay. Some other red flags to be aware of is that treatment facilities should have a website. And on that website, you should be able to access program staff, services. So if you come across a program where it's very hard to get that type of information, that could be another red flag as well. Most treatment programs or facilities will list who their board of directors are. They'll list who they're certified by, who they're licensed by. They'll list treatment staff and the services that are offered. So those are the things that you should be able to access on that program's website. And if you can't, that can also be a red flag as well. So a question comes up sometimes about what happens if I find a treatment program. It really seems to meet the needs of my loved one or my significant other, but there's a waiting list. One of the things that I suggest is that when you're looking for a treatment provider, look for several. Okay, you want to look for several because if there is a waiting list and your loved one or your significant other is ready for treatment, you really don't want to wait too long because they're ready, they're motivated, and you want to get them in as soon as possible. So if you come across a program that you really like, but there's a waiting list, what I suggest is also look for other treatment programs that fit your needs as well. So you want to have at least a list of maybe 2 or 3 programs that are ready to accept your loved one. And the one that can get you in the quickest, based on what your needs are, is the one that you should go with. Because it's really important to, when a person is ready for treatment, it's really important to get them in as soon as possible. So again, I would suggest that when you're looking for a treatment provider, that you look for a few or look for several. And if they're similar to what your needs are, get them into the one that has the shortest waiting list or one that doesn't have a waiting list at all. So one issue or question that may come up when one is applying for insurance is, what happens if I get denied? Well, there's several things you can do if you get denied. One is that you can appeal or you can grieve the denial. And one of the ways to do that is most states have a insurance commission or a commissioner of insurance. So you could apply your grievance to that department in your state. The other thing that you would need to be aware of, which will be extremely important, is to find out the reason why you were denied. So each insurance organization should have a standard by which they base a denial on. You will want to know what the reason was or is in terms of why you were denied, because that'll be important also. These are all our questions for today. Thank you for joining us. For more information, please go to drugfree.org. Thank you for watching Experts Answer, a video series by Partnership to End Addiction.